Hey guys, today we're going to talk about trigger points. So maybe you're used to feeling like knots behind your shoulders here, right? Extremely painful if you spend a lot of time on a desk or in a seated or technology type position, or maybe you do a lot of repetitive motion like golf and you're used to feeling knots in your low back, right? Trigger points are very prominent and they're very common, but it's important to understand why they're occurring and how to treat them, right? So trigger points are actually a muscular condition, right? So a nice healthy muscle should be nice and relaxed, and they have fibers, which will be represented by my fingers here. So a healthy muscle will relax, and when it's told to contract, it'll contract and then again fully relax. So what happens with these muscles that develop trigger points, right? They contract and then they never fully relax, right? So what that happens is we get a buildup of what's called lactic acid in those overlapped fibers, and that causes a lot of pain in the muscle if it stays for long periods of time, right? So lactic acid is a normal byproduct of the muscle that's supposed to be flushed out with the blood flow, kind of its waste product, right? But if those fibers are overlocked like that, that blood flow can't get in there to help alleviate some of that lactic acid and flush it out of the system, right? So what we usually recommend in this condition, when there's a lot of trigger points, is we do a lot of active release technique on our patients here, which is the gold standard of soft tissue treatment. Or if you're at home and you're not having chronic and maybe it's a newer type trigger point, we do recommend a little bit of heat, but you have to be careful with heat because if there's any inflammation, it can kind of send you in the wrong direction. Make sure you watch our video on ice versus heat for more on that. But that's kind of the synopsis of trigger points. I hope this was helpful. I hope you learned something, and be sure to follow our page or reach out if you have any questions.